Plagiocephaly is the medical term for flattening of the head. It's very common in children of, especially in the newborn phase, due to the positioning of laying your baby flat on their back to sleep. There also can be some other conditions that can increase the risk for plagiocephaly, including in utero positioning, as well as some other pathological things, such as craniosynostosis, in which some of the sutures in the brain can close a little bit earlier. So as your pediatrician, it's our job to monitor your baby's head growth and the different shapes that may present to see which ones are typical development versus ones that need to be intervened upon. General plagiocephaly, in which is caused by positioning of your baby, more so where you just have some flattening in the back of their skull, oftentimes improves with increased tummy time. So you'll hear your pediatricians recommend that after their umbilical cord falls off around 2 weeks of life, to start putting dedicated time with your baby on a flat surface so they can strengthen those neck muscles, and also allows to take some of that pressure off the back of their scalp. We normally see improvement within the first 2 to 4 months. If you don't really see much improvement, or there's significant flattening, or you might see some asymmetry where one side is flatter than the other, those will be concerns that you definitely want to bring to your pediatrician, but that is something that we're monitoring very closely during those first few appointments. There are other conditions that might predispose your child to having the asymmetry. Those include torticollis. So if your child prefers to keep their neck turned one way or the other, that can also predispose them to having that flattening. In those situations where, we feel that positioning alone may not be enough to help correct that flattening of the skull, you might have a conversation with your pediatrician that includes physical therapy, as well as considering getting an assessment for a plagiocephaly helmet. My daughter actually suffered from moderate to severe plagiocephaly, brachiocephaly, and so we underwent the helmet journey ourselves. So I'm very sensitive to that issue. The nice thing about these helmets is that the earlier you intervene and get assessed, and if you meet the specific criteria for that, the shorter amount of time that you'll have to be in that helmet. It is a commitment. You do have to wear it pretty consistently for about 23 hours a day. The helmet is a nice addition because it helps to support the development of the skull as it enlarges, to help position it in a less flat manner and in a more typical way. So these are conversations that we want you to bring to us as your pediatricians, and that we may also bring to your attention when we're doing our assessment. Don't be afraid ever to bring up your concerns, because we're happy to go over those with you at any time.